The next thing we're going to talk about is direct intubation. This is your blade handle, and you'll see there's a bar there. And this is your blade, and there's a hook. You see the hook goes over and clicks onto the bar, and you open it. And as you open it, the light will come on, and it will be secure in place. If the light does not come on, then you need to find yourself some new equipment that will work. There are two blades we can use. We have a curved blade, which is a Mac, and this is the one we most commonly use for adults. Looking at our airway model, you're going to hold your blade in your left hand, and you're going to place the curved blade in this space, posterior to the base of the tongue, and you're going to raise up to see your airway. Alternately, we have a straight blade, which is also called a Miller blade. The Miller blade attaches in the same way as the curved blade, and you open it to have the light come on as well. The Miller blade is most commonly used in children because of their floppy epiglottis, and it's easier to see their airway with a straight blade. What you need to know about the straight blade is that it goes in a different space from the curved blade. To remind you, the curved blade was placed at the base of the tongue, and the straight blade is placed beneath the epiglottis to open the airway. And you want to make sure that you have your endotracheal tube, and you want to make sure that you have a flexible stylet. The stylet goes inside the tube. It helps you direct the tube through the airway, and you want to make sure that it does not come out the other end of the tube and damage the structures of the airway. We recommend you put a bend in the top of the stylet so that it does not inadvertently get pushed forward. You will take your 10 cc syringe and you will check your cuff before you intubate your patient. You of course want to make sure that your balloon is deflated before you intubate your patient. The trick on the mannequin is that you are trying to line up the patient's airway so that you can see the cords clearly. We suggest you place the patient in a sniffing position, and you will take your blade in your left hand. You will sweep the patient's tongue out of the way, and you will think about lifting the blade into the opposite corner of the room. You do not want to just crank back, or you will hurt the patient's teeth. So again, you're trying to line the airway up. You take the blade and you raise it to the opposite corner of the room, and then you will need to look down to see the structures you're looking for. When you see the cords, you will take your tube, you will direct it to the cords, and then, making sure to hold on to your tube, you'll remove the stylet, you will inflate your cuff, you will place the CO2 detector on the tube, and then the bag on the CO2 detector, and you will bag your patient. Again, you'll be watching for color change in the CO2 detector, and you'll be listening to the patient's lungs on both sides and the epigastrium to ensure correct tube placement.